Welcome to the Operating Room 101, the modern operating room and patient safety. Please take a look at these 4 images. They are a record of the conscious decisions hospitals have taken over the last 80 years to address operating room design, layout, equipment, and safety protocols to better ensure improved patient outcomes. In the following video, we will discuss disease and infection prevention practices established to help meet critical patient and staff safety objectives. If you are given the opportunity to observe in the operating room, you must be trained on the important safety guidelines identified in this video. You'll note in this image, the observer is standing 18 to 24 inches away from the sterile field. Before starting your clerkship year, the operating room trainers will be showing students a presentation that will include information on surgical scrub and gloving and gowning. As clerkship objectives require operating room participation that necessitates the knowledge of these advanced skills. The Association of Perioperative Nurses guidelines were used to support the policies and protocols we'll be discussing in this video. Their guidelines are considered the gold standard of evidence-based recommendations to deliver safe patient care and achieve workplace safety. So you'll hear or see reference to them multiple times throughout the presentation. Additionally, after each operating room guideline, you'll be given the why behind it. First up is hand hygiene. The Association of Perioperative Nurses state that hand hygiene is widely recognized as a primary method to prevent healthcare-associated infections and the transmission of pathogens in all healthcare settings. Normal skin flora on the hands includes transient and resident microorganisms. If not removed through hand washing, transient microorganisms can colonize the superficial layers of the skin. Then these microorganisms may be transmitted to perioperative team members when they come in contact with a contaminated surface. Next up is personal protective equipment, or PPE. It is designed to create a sterile, fluid-impervious barrier between patients and the surgical team. The minimum required PPE for observation in the upstate hospital includes hospital-laundered navy blue operating room scrubs, hair covers and shoe covers, eye protection, typically the eye shield, and an operating room mask, which is different from the standard ear loop mask. Next is the general operating room environment. Hospitals separate the operating room into 3 distinct perioperative spaces: pre-op, intra-op, and post-op recovery. It's one more way to prevent the spread of germs, to help keep patients safe. And it improves hospital efficiency, as different spaces allow medical staff to focus on specific tasks at the appropriate time. In addition, all modern operating rooms incorporate a zoning system. Zoning is a strict hospital design rule. It uses different areas to help stop germs from spreading to keep everyone safe. The first is the unrestricted zone. That's everything before the yellow line, which includes the main operating room desk, the locker rooms, and the pre- and post-op areas. No PPE is required in this zone. The second is the semi-restricted zone. This is everything in the hallways past the yellow line. Everyone in this zone must be wearing the navy operating room scrubs, a hair cover, and shoe covers. And the third is the restricted zone. This is considered the specific operating room where the surgery is taking place. When observing a case, the PPE from the semi-restricted zone must be worn, with the addition of an operating room mask and eye protection. Next up is the sterile field. The Association of Perioperative Nurses teaches to keep the bubble safe, because protecting the sterile field helps prevent harmful, life-threatening bacteria from entering the surgical site. These bacteria can produce infection that can slow healing and may be extremely hard to control, requiring a patient to endure a long, costly hospital stay. And one more way the modern operating room takes steps to protect the sterile field is the laminar airflow sealing. It consists of HEPA filters that release a steady stream of clean air downward over the surgical patient. It keeps a constant air pressure in the room and sweeps away contaminated air particles through exhaust grills, preventing them from rising back into the sterile field. So, it's extremely important to avoid creating unnecessary air current around the sterile field by minimizing traffic and always using the small door to enter and exit the room. To complete this transition to medical school module, you must take the accompanying quiz and read and complete the attestation on PPE and the or-approved surgical scrubs. Anyone interested in shadowing should join the club of their desired specialty and consult the club for shadowing rules. The general surgery clubs and interest groups' shadowing rules are posted on this Brightspace page. On a side note, this module replaces the non-scrubbed observer training the Department of General Surgery used to offer. Thank you for watching. For more information on this presentation or general surgery shadowing, please contact Rebecca Bellini.